All right, everybody, welcome to the Ramsey County Board Workshop. Today's workshop topic is the American Rescue Plan Act update. Courtesy reminder that this board workshop is being recorded and is live streamed on Zoom webinar. There will be no votes taken during this workshop. Let's start with introductions of commissioners and presenters around the table and then around the room. Yes.
Mike Fangshan, Ramsey County Commissioner, District 6.
Rafael Ortega, District 5.
Tara Jebin Singh, District 1.
Rena Moran, Commissioner, District 4.
Lynn Becker, County Manager.
Amy Karen, Public Health Director.
Nora Moore, Emergency Preparedness and Response Division Manager.
Kristen Peterson, Program Evaluator.
I realized I forgot Kelly Miller, Commissioner, District 7.
Deanna Pesic, Chief Compliance and Evidence Officer.
Kathleen Murphy, Policy Aide to Commissioner Miller. Maureen Sarabia, Chief of Staff to Michael.
Kim Thompson, Housing Stability. Lori Pierce, Housing Stability.
Keith Lattimore, Director of Housing Stability.
Diane Holmgren, Deputy Public Health.
Casey Yang, Chief Clerk.
Christy Cox, Planning Specialist with Workforce Solutions. Karen Francois, Deputy County Manager for the Information and Public Records Service Team.
Carrie Collins, Deputy County Manager for Economic Growth and Community Investment. Alex Kutza, Interim Deputy County Manager for Health and Wellness.
Shasky, Public Health Division Manager. David Master, Health and Wellness, Innovation and Strategy. Teresa Young, Workforce Solutions Director.
Elijah Rosade, Youth Justice Transformation Planning Manager.
Please, Policy and Planning.
Lindsay Bernard, Policy and Planning. Rachel Molinar, County Manager's Office. Kim Hansen, lots of different offices. Stevie,
Deputy Public Health.
All right, so good afternoon, everyone. Thank you for being here for the second of 4 workshops on the Ramsey County investments of the American Rescue Plan Act dollars. After receiving information this morning on the overall investments of Ramsey County made with the American Rescue Plan Act funding, this afternoon we are focusing on 2 departments that made significant contributions to our work during the COVID-19 pandemic and the investments made there. During this workshop, Public Health and the Housing Stability Department will provide information on their department roles in the COVID-19 response, how funding was used, what we learned through the process, and ongoing work in each of their areas. Again, thank you for being here, and now I will pass it over to Director of Public Health, Amy Karn.
Thank you, Mr. Chair, Commissioners, County Manager. Thank you for the opportunity for us to share our public health work with you. Today we'll share a few initiatives, a really high level view of what we did. So under the American Rescue Plan Act funds, we had, they were a very large contribution to our work. In addition to that, Public Health also received COVID-related funding from the Minnesota Department of Health. So in telling our story, there's a few blurred lines because the work was all part of the same effort that we want to share. So various funding sources. Although I was not a part of the Ramsey County team during the height of COVID, I did oversee and conduct similar work in 2 greater Minnesota counties as the Public Health Director and Incident Commander within the Incident Command System, and then boots on the ground work, being in very small counties. So I just wanted to give you that context. Hence, I will not be talking a lot today because I was not here. So I have my 2 colleagues here that are going to go through this PowerPoint presentation, and I'll hand it over to you 2, Nora.
So I'd like to take a minute to provide some context and set the stage for our COVID-related work. Our first COVID case was identified in the United States on January 20th. A couple weeks later, our public health established the Department Operations Center to begin to plan our response. And then on March 6th, 2020, the first COVID case was identified in Ramsey County. I had the privilege of receiving that call and doing that follow-up work. It was also the first identified case in the state at that time. And then following that, the public health emergency was declared at the federal and state levels on March 13th, and then for Ramsey County the following day. So here's a snapshot of public health's COVID response. The Public Health Department Operations Center was operational for 169 weeks. That's a little over 3 years. 215 of our public health staff were officially involved in the public health response. And those roles included disease tracking and contact investigation, vaccination clinics, essential services, communications, and planning our response and services as the needs changed. Additional staff who are not counted as part of that 215 also contributed to this large response effort to track spending, manage contracts and agreements, and account for time and purchases. We also hosted over 680 vaccination clinics, many of which were in partnership with over 80 community partners. This is a snapshot of the open data portal dashboards that were created during the response. Throughout the pandemic, several indicators and data points were available through the open data portal. The data is still available, although we are focusing on maintaining just the top one, the surveillance dashboard, as the other two have been since archived. And we don't have time to go into the portal today, but I do encourage you all to look at the data if you are interested. So public health provided both short-term and long-term services. So in our tier 1, for people in need of immediate relief, the programs that we implemented included our essential services. So we connected residents with housing and shelter, particularly when a family member tested positive and needed to be isolated, and weren't able to find enough space in their own home, or there were a large number of other family members present and at risk. Our essential services teams not only identified shelter, but also provided food and medication to those that were identified and put in isolation. We worked very closely with the precursor to the Housing Stability Department and set up the only COVID respite center for unhoused individuals within the state, and maintained that through the peak of the first wave. This work then was transitioned into a hotel programming and continued with the Housing Stability Group as it was established. And critical to our core public health functions, we also provided and partnered with other community agencies to provide testing and vaccinations, as well as part of our tier 1 work. And this was critical to reduce the spread of COVID. And our longer term investments included our work with our Trusted Cultural Community Messenger and Connector program, which we'll be sharing more information on later in the presentation. So ARPA funding, along with a lot of other public health funding, was invested in many of these COVID response activities. So including the essential services work, as I mentioned previously, and our vaccination clinics in community. We partnered with many different agencies such as ML Fairview, Black Nurses Rock, as well as Open Cities Health Center, as well as the Mexican Consulate and several others. Our communications team supported all of this work and helped to coordinate communications through the contracted agencies. And we also focused on mental health promotion and partnerships with our mental health and wellness community action team, as well as community contractors, to host monthly culturally healing sessions in community spaces with cultural healers and non-traditional practices. The ARPA funding also supported additional physicians' support for coverage and backfilling in our clinical services division, as well as additional anti-violence advocates on the SOS sexual violence program, as those incidents were also on the rise, and nursing staff to assist with our vaccine management. And finally, our Trusted Cultural Community Messenger and Connected initiative. And these are some snapshots of the work that we did in community around our vaccine and testing sites. So our vaccination clinics were hosted inside as well as outside at different community locations, such as the Mexican Consulate, the Kren Organization of Minnesota, and numerous other religious and community organizations. And in just a little over a year, to give you some background on our personal protective equipment, or PPE, we distributed over 850,000 individual pieces, and we're able to provide 78,000 vaccines through our 680 clinics. And these are some comments that were feedback that we've collected and received from community partners around our work during COVID. So the staff of St. Paul Ramsey County Public Health showed true passion and commitment to helping serve our population. We are especially thankful that vaccinators were willing to work on Sundays in order to accommodate our community in a way that enables more people to be vaccinated.
We're going to hold our questions until about 2:05, and then we'll jump in for questions from public health.
Other comments include, given the degree of ethnic diversity and wealth inequality in this relatively small county, I was impressed with the efforts to bring vaccines to all segments of society, especially those who would be unlikely to access regular clinic pharmacy settings. So in addition to collecting feedback from community members, we also contracted with Tidal Basin to assist with our department's after action report. And through this process, we were able to establish and identify strengths, opportunities for improvement, as well as recommendations for how to change our work going forward. And some of the key strengths identified include that the leaders were unified and operational functions worked well. The availability of limited duration positions to support ongoing work was very beneficial. And as already been mentioned, relationships were essential. And finally, the learnings that resulted in changes to policies and procedures will have lasting benefits on the work going forward. We also did identify, of course, opportunities for improvement, including an increased attention to staff well-being due to stress. And also at times, staff were trying to balance being deployed as into a response role, as well as continuing to do their regular work. And more of an external challenge was the difficulty in getting timely and specific data to help focus our efforts. And finally, for going forward, we identified several different items. So after what we experienced and learned during the response, we found a bolstered recognition of the need to plan for ongoing and just-in-time training in this work. We must elevate staff wellness and balance when we are in the response mode. And we need to continue to work with community partners, knowing that having these strong relationships prior to the crisis response is incredibly beneficial. And while possibly nothing could have fully prepared us for the COVID pandemic, we know that including training throughout the workforce is critical in order to respond. And with a new appreciation for our Medical Reserve Corps, which is currently 264 members strong, we're transforming our work in this area with the completion of our new MRC strategic plan. And finally, experiencing the critical value of trusted cultural messengers and community connectors post-COVID, public health has continued to use this model to communicate, inform, and educate our communities about important public health issues. And so with that, I'll turn this over to Kristen.
Early in the pandemic, Ramsey County initiated the Trusted Cultural Community Messenger and Connector program. And the purpose of that was to fully communicate to our community and residents about COVID topics, the disease, testing, prevention, and response. It was supported by both CARES and ARPA funding. And over the course of several phases of this initiative, the program had 15 partners and continued until the end of 2022. The evaluation of the initiative found several things. One is that all partners that Ramsey County worked with met or exceeded the goals that they had set for themselves for this initiative. We had approximately 920,000 points of contact that were made by a variety of ways, whether that be one-on-one or radio, social media, different clinics, or vaccine and test distribution. The initiative strengthened the relationships between community agencies and public health and created some long-term partnerships. Beginning in 2022, Public Health received an infrastructure grant from the Minnesota Department of Health to continue this trusted messenger work. And the goal of that program was to enhance communication between the county and community, to focus on public health priorities that their community decided on, and to convey public health information that was with cultural wisdom and best practice. They also engaged in racially, ethnically, and culturally diverse communities, collaborated with public health, content experts, and shared feedback and concerns throughout the program. The two primary capacities that public health chose to focus on were community partnerships and health equity. And this was done through an approach that decreased health disparities and inequalities related to racial and ethnic injustices, develop new and maintain existing partner relationships. It was really a focus of listening and responding to partners, and to create intentional opportunities for trusted messengers and residents to really lead with their voices and their ideas, rather than what the county thought they should be saying or doing in community. This is just a example of when we had our initial meeting with our trusted messenger agencies. We had a full day convening, and we hired an data artist Anna Gomez, who in the end created this visual for us, which focused on where our trusted messengers were coming from, where they were in their journey with the county, and some of the hopes that they had by participating in this, since that's very small, is connecting community with information resources and supportive services. They wanted to deepen partner connection to Ramsey County, but also to fellow trusted messenger partners. And thirdly, they really hope to authentically reach communities. They wanted to have open and honest conversations on public health issues. That was critical. The first round of trusted messengers are reflected here, and you no doubt recognize many of these community agencies as they have worked with Ramsey County in different ways. The public health topics that they focused on, again, these were choices they made based on what they heard in their community, were things such as chronic disease prevention, mental health and well-being, substance use prevention and education, sexual violence services, and improved access to food, among some others. The current cohort of trusted messengers, there are 11 that are in process now, were also given the freedom to choose the topics that best meet their community's needs. And those topics are similar. Some are working on chronic disease prevention. We have several who are working on adolescent health, environmental health, healthy aging, and also food resources again. This is a visual of the diversity of what types of activities our trusted messengers engaged in. So we had trusted messengers doing everything from social media to small healing circles to community conversations or tabling at events, food distribution, newsletters. So we really tried to make it as flexible as possible for them to really get to community in the ways they best saw or as the most productive. And this is some examples of photos and flyers that our trusted messengers provided to us as they were hosting events. Again, by design, we really wanted them to choose. So some of our partners chose to have smaller events, which maybe had 10 to 50 people who attended. But then we had some outreach clinics like St. Mary's, where maybe 50 families would attend. And then we had events that were like Facebook Live events and webinars that some of our partners did. And those easily reached 500 people for each event. And then social media posts, our partners who did that were often reaching over 1,000 people with every post that they had. And most of our partners reported working with more than one population. They maybe had one target population, but they were stretching across several different populations. And in closing, I will share a couple of reflections from our trusted messenger agencies. The initiative has also fostered collaboration between community groups doing similar and complementary work. You can see that by the second quote, where one of our partners, Plus, elaborated that their collaboration experience with other partners, St. Mary's, really impacted the the positive impact of their event, because as they said, their provision of services such as blood glucose screenings, blood pressure checks, health education, and information about clinic services has significantly contributed to fostering trust within the community, and the presence of familiar faces who speak their language and offer free screenings at these events reinforces confidence among community members. So St. Mary's showed up at Clueless events to work with their residents who were waiting in the lobby or elsewhere for things that Clueless was providing. And so we had a lot of this throughout the program where our partners were promoting each other's events or attending each other's events. And that is definitely a long-term positive impact of this program. And the work has been transformative and impactful, but I think it has truly expanded public health's messaging and our goal to positively impact health in our community.
Commissioner Jevon Singh and then Commissioner Schnell.
Thank you. I have a number of questions around the community connections. First of all, just lifting up this work. I think that this is really important work, and I'm glad that you can give such a rich description of what was happening during COVID. My question, I guess, starts with what investments in these kind of these community connections were being made prior to COVID? What was the baseline that you felt like you were starting from?
I think it was pretty new with COVID is my understanding. Yes, that's my understanding.
And then I guess the question too is how have we been, do these investments and initiatives, are they all continuing forward, or is this something that we're looking back and saying that was great for that 2 years of time?
Well, currently it's going forward based on a grant we have received from MDH. So the infrastructure grant, we have received funding that now goes through June, and we have reapplied for a third round of funding, which would start in July. So right now, the work that is Trusted Messenger is being funded by MDH grants.
I can help with that response too. I do think that in other parts of the county, we have started to leverage this by seeing public health as the original model. I know I don't see our director of communications here, but you know, the Monroe radio work that they're doing, like all of this kind of started through public health kind of leaning into that. I know multiple departments, and workforce was one of them. I know you know, CED did a lot of work with like their small business relief. That, you know, I think there's a lot of areas where we saw that this mattered to our community, and in different spots we were trying to do things differently. And this is one of those opportunities, right? Like, how do we sort of organizationally continue to leverage these relationships going forward? So.
And I think what we said in our presentation too, that before something happens, it's really important to have those really strong relationships out in the community. You can't do it alone to respond to something like this.
Well, yeah, and I guess that's my follow-up is from our workshop earlier today, the idea of really trying to transform the relationships that the county has with community partners and vendors and organizations is less transactional and more relational. And just the idea of continuing to not have this be an extracurricular when grant funding is available kind of mode of action to this is just foundational to how we do the work that we do, right? And just coming from community-based work, the idea of having to invest, you know, lots of time and energy in building that trust and real social capital and investing and pouring into other folks' initiatives so that then when you make the call, it's not, you know, you've got that, you put into the pot, so to speak, before you ask to take out of it. So I like that we're continuing to build off of this time during COVID, right? But I also, one of the things that having come from an educational background to working in school districts where we have our culture liaisons and other like titled folks who do tremendously impactful work to make educational institutions accessible to our families and to lift up the work that our teachers and other learning professionals do. Sometimes those roles can be kind of an intermediary between us doing the work we need to do internally to be able to be providing services authentically to all of the members of our community without having to have that somebody who then acts as the in-between. So I'm wondering how we're also using the time that we're spending with not only to build those connections, right? Not everything can be done through the county, but how can we also be deepening our own internal capacity to build those trusted relationships just as the work we're going forward? I'm just curious if that's something that's been part of this transformational work.
I think what you're asking is like the money that we've invested thus far within our own staffing structure. Is that what you're saying within our infrastructure?
Well, I
Then
would
in
say this,
turn-
well, it could be funding, but also just in the way that we choose to do our work.
Mhm.
You know, the flexibility that we give folks to have the extra 5 minutes before and after a meeting to actually engage with people, the time that it takes to allow people to attend community events on the schedule of communities. So that you build relationships outside of a formal meeting. I mean, all of the different things that aren't necessarily connected to a dollar, but just how we approach the work that we're doing.
Definitely, we could probably give you a lot of examples how we do that now and prior to COVID, especially like through our ship work, I'm thinking.
Yep.
We have also have our community advisory committee that we tap into. We're right in the middle of doing a community health assessment, so we're reaching out to community for that to come up with our top health topics. So we interface, those are just a few examples, but we interface with our community partners.
And the reason why I bring this up is because for those people who do this naturally, they do it naturally. And for those people who don't, it's a big mystery. And so sometimes it's okay to say out loud the things that are working and the things that haven't worked, the things you tried and that fell flat, because it emboldens people for them to start adopting those behaviors as well. So I like this chance of being able to reflect and look back.
Yeah.
Yes.
Commissioner Sean?
Thank you. I'm looking at, let's see, which slide is this? Slide 12, but yeah. Just about, can you share more about the need or desire for data that hampered the efforts, or which data sets were needed to make better decisions?
Yeah, good question. I think we being an emerging infection that we didn't understand or have any epidemiological data on, it sort of was just the basics of what an infectious period looks like, what an incubation period looks like. Really sort of added on to the challenge of planning and responding and making recommendations around isolation and quarantine, and then building an essential services plan that would support that, determining endpoints to essential services provision when people can be out of isolation. So having those kinds of data available weren't always possible. And so that thus then contributed to the difficulty.
Yeah.
And it was changing too. So we would get data and then it would change. Or we would get more data and have a more sort of broad and inclusive understanding of the disease and how it transmits within the community and the impacts it has, so that thus we could change our programming to better align with what the needs were.
I think early on too, we struggled a little bit with our state departments trying to get, data back and forth, that health data. And that's probably a positive too that came out of COVID, is that, now we have some infrastructure grants and things going out statewide, where we can kind of better talk to each other with our data. So that'll be ongoing work.
Yeah, we have a electronic disease database called MEDS in Minnesota, and all of sort of disease reporting is centralized to the state and gets reported there first and then gets shared with the locals. And with COVID, MDH did not choose to use that sort of standard reporting procedures, and they built a whole brand new database in a completely different software program. And so the challenges of then onboarding local public health departments into this brand new database, getting that data sharing, that was all a separate brand new initiative. And then they eventually transferred everything into our usual go-to MEDS database. So.
Wow. That is
all in the middle of a pandemic.
Yeah, horrific. Yes, to say the least, with what you all had to go through then. Because I would say just not being able to talk with each other there. created a lot of like lasting impacts.
Mhm.
Like there are communities who are still recovering from that,
Mhm.
right? And there were a lot of people who died due to COVID. And it was just very unfortunate that like we just weren't able to you know, get data, but also to like just identify where already are the disparities and how communities connect with each other, right? So I know that 55106 was definitely one of the communities where they saw them like disproportionately, like who died of COVID-19. And that's also the same district and same area that saw the biggest growth in population since the census there. But also there weren't a lot of housing units that were built. So that was doubling up. People were doubling up in communities there. And that's how COVID spread and that's how folks died. So I hope we can just continue to use like our different data sets
Mhm.
of what we have at the county, right?
Mhm.
To help inform our work moving forward about how we meet the needs of different communities, right? So I just hope that we are using that data sets from all across departments,
Mhm.
just so that we know who receives this type of services and the demographics of them and
Mhm.
where that need is. So I hope our research around food access, right, gets layered on with how we support communities, including the work that Health and Human, I believe DC Young Kutsa's presentation about, you know, WIC eligible communities, right? In addition to that, also communities where we have our youth who are entering into our JDC.
Mhm.
Like those are like clear signs and indicators of distress, you know, in communities. And so I just really hope that we can use those data to like help us provide more like narrow and focused approach to supporting our communities.
Go ahead, Commissioner.
Hi, so I just want to first start off by saying thank you for your presentation. I think it was great. And I think I want to focus because you spent a lot of time on like the voices of community partners. There's a lot of slides on trusted messenger. And the one thing I know early in the process when COVID hit is that the original message was that it is impacting the elderly, senior housing, nursing homes, right? And there was a lot of targeting those type of institutions and not really communities of color. And to the data, you know, we had to like, I remember at the state level, we had to specifically lift up that there was people of color who was dying at a higher number than anyone was talking about. To really get the state to begin to invest in those communities, right? With something that you're calling trusted messengers. And so I just want to appreciate Ramsey County Public Health for taking the lead in doing that, because it was really, really necessary to go into diverse communities, to really partner with those communities where they can hear from each other the need to isolate and do all the things we know our communities needed to do. I wanted to ask, as you talked about how you partner with the trusted messengers, and I appreciate you including in your presentation the opportunities for improvements, right? I think that was really great that you was looking for, you know, how can you improve things? And then you named it and you wrote it down. So I really appreciate that and how you share that, how we can work differently, looking at system transformation. I think those are really, really good way of documenting how you can continue to move forward. So I really appreciate all of that. And so as you go through and you spend time with the trusted messengers and what it took to have diverse communities safe, I'm wondering if, and what I also know and have learned and continue to learn, that as a government entity, we sometimes see our work as being successful and moving, and we can rail about it, how good it was. And then we go back to community, they'd be like, what? Well, this was our experience. So I'm just wondering, at some point, if have not already done so, do you think you can go back to some of those trusted messengers and have them reflect over, that experience? And maybe, collect some data on what that looks like from the community perspective. Because I think that can also be helpful in how, Ramsey County can continue to partner and be in relationship with those communities and those trusted messengers.
So we do have the trusted messengers submit reflections on a quarterly basis with
Okay.
us about how the program's going, what gaps they're still seeing. Are there more resources with our county that could be helpful? The thing as an evaluator, since I've been on this program since COVID, the thing I'm doing differently this time around is trying to reach the residents that are working with our trusted messenger. So getting to the partners events and seeing how it's impacting residents, because prior to now, it's been, we get our information from our partners and they tell us how they think it's going, but we don't then go to the people coming to their clinic and ask them how it's doing. So that is something by getting more community engagement evaluation that we're trying to implement this time around, of really showing up at these clinics or tabling events and interacting with community to see the actual impact on community.
Accountability is important, right? You want to make sure that it's doing what you hope it is doing and what people are saying it's doing. I don't know if you shared in here whether or not the remarks from the community, was that in here?
Yeah, there's some in there, yeah.
Okay, so it is some in here.
Yeah, and some of those are from our partners
Okay.
too.
And as part of the after action report, some of the community partners for our vaccination clinics or testing sites, they were included in that cohort of interviewees.
Okay, all right.
They have Commissioner Jevonsing and
Oh,
then Commissioner.
I was just going to ask is, two questions are kind of the same. One is how much, have we, in these partnerships and trusted partnerships, have we included the, engagement with our local collaboratives, the Suburban Ramsey Family Collaborative, St. Paul Collaborative, and Child and Mental Health Collaborative, meaning that by participating in those spaces, there are, hundreds of organizations that are sitting around those tables on a regular basis. And the reason why I ask that is because to see how the inroads that were made for the COVID, reacting to COVID and making sure we were doing appropriate responses there, and some of the small grants you had on the community determined public health issues. How much are we using for our Ramsey County initiatives to still use these partnerships? I think of things like responding to the mental health crisis or opioid response or other kind of public health issues that are coming our way. Are we continuing to build off of these relationships that we learned in COVID to continue moving that forward?
Well, the partners that we have are directly connected with content experts and programs in Ramsey County. So those of our partners who are interested in adolescent health, we connect them with our adolescent mental health coordinator. And that person is like anytime something new comes up, anytime there's a webinar, anytime they're sending that information to those particular partners. So the partners are getting connected with the areas that are the areas they're focusing on. And then those content experts are really taking the lead in making sure they're informing the groups with as many resources as we have. So that is currently going on.
I can speak a little, Madam Chair, to the collaboratives too. So I think I've spoken to different one of the commissioners. I know you all participate in collaboratives. As a county, I don't know if we've been as aligned internally as a staff to make sure we're leveraging our collaboratives to the extent that it's possible. We certainly saw, and I had saw firsthand with SRFC, that for this morning's workshop around the table was set. I mean, there is a table there that quickly mobilized, and there is a lot of opportunity there. And I do believe our public health director, I know Amy's fairly new, our library director, different directors, myself, when I was a workforce director, sat on those collaborators. We need to do a little more cross pollinating as a county, and I've started that conversation with some of the folks. I think, Kim Stubblefield also in corrections. So I do commit that we have to do a little more, house cleaning on our collaborative leadership from the county side, while currently, as you're all very well aware, we are doing some evaluation of our collaboratives as well. So I can anticipate sort of a lot of opportunity to talk about collaboratives as we do our work a little bit better, as we work through that evaluation and do some of that leadership coordination with our own county staff as well. And you've all asked for it, just so you know, even before your predecessor asked for it as well.
That's fantastic.
Yeah.
And I will say this builds off to Commissioner Moran's question earlier about when we have transition of leadership. You know, the one thing is it's hard enough to transfer policies, procedures, like how we do the actual job at hand. But you can't just say, and like, here's my friendship badge. This person trusts me, now they trust you because you now have my old title, right? It doesn't work that way. And so making sure that that's the idea of being very overt about the work that you're doing and the value of building those relationships has, and the intention that has to go into that.
Thank you.
Thank you.
Commissioner Shaw? Another question I had was just about our trusted messengers, and I guess kind of now post COVID, like what are the expectations now for our trusted messengers, as well as how do we choose our trusted messengers?
So it's an open RFP application process. And we try to get a variety. We've gotten a variety of people who are working with the communities that are most in need. So they're kind of chosen based on that. They have work plans. But as far as what they are focusing on, we are really trying to make it be about what they need it to be. That came from COVID. I hosted several focus groups during COVID with our trusted messengers. And we were hearing things all the time, like, we have enough information about COVID. Now we need information about housing because our people, now we need information about mental health because all the kids are out of school and are suffering. And so that all came out of COVID, of just like, yeah, we get that there's a pandemic, but now there's all these other issues in our community. So that's why this round, we really wanted to say, okay, now what's going on in your community as post-COVID, now what are the key issues? So we really have allowed them to focus in on the issues that they see the most in their communities.
And is there a connection then with helping support to inform our community health assessment then?
That I guess I don't know for sure how.
We'll have to get back to you.
Yeah.
I think.
Right, because we're creating a new one this year.
Right. Yeah. I mean, we've always had community input on that, but I guess I'm not sure if that's a separate thing.
I have an upcoming like community input meeting in a couple weeks, the first one that we're putting out there, and then we do rely on our advisory committee also. But there's various ways, like focus groups and surveying and things like that, so we're getting
Right
there.
Right. Yeah, and I suggest this too, because, you know, there are folks on the ground, right? They're hearing things from their community. But, you know, they may have a different perspective, and they're also providers, right? They may have a different perspective than what we would get from our community advisory board. So I would highly encourage, like a deeper relationship there with our trusted messengers.
All right, thank you
I have a
all.
question.
Quickly, and then we'll move on.
I'm changing the subject. Can I do that? But it's a public health, crisis. I mean, it's a public health question around vaccinations and measles and things like that. Because, you know, within our community, and these young folks nowadays don't believe in that stuff. So are you seeing anything different or way to connect with the whole vaccination pieces now? What is that looking like for public health, right?
Well, I know we do have community health workers out there that reflect our various populations. And I don't know if you can speak on immunizations, like through our MIC, that's our system that we have statewide, that we look up people's immunizations to see if they're on track, things like that.
We talked about, you know, using board meetings with those informational items. Maybe, Director Karen, if you want to consider coming back with that as something that seems like the board's interested in that work.
I'm
This is
feeling
like-
challenged.
Yeah,
out there
yeah,
trying
and
to-
this kind of your infectious disease sort of outreach work. Yeah, I can follow up with you.
Okay,
Yeah.
all right, thank you.
Thank you very
Is that
much.
okay?
Thank you.
Yes.
Okay.
Thank you.
Thanks.
Thank you.
Welcome, Director Lamar.
Thank you.
Just you up here by yourself?
I know.
No one else wants to?
Flying solo, I think. I may have to call on them, but we'll see how things go. Thank you. My name is Keith Light. I'm the Director of Housing Stability. And I wanted to share, let me just make sure I get this here going in the right direction.
Yeah. We're going. There we go.
All right. Here to talk a little bit about the housing stability and our investments during COVID-19. I want to take you back, kind of what was existing prior to COVID coming to Ramsey County and actually to, the world for that matter. When we first looked, we know that we currently have shelter partners that we partner with on an ongoing basis, and they had been doing the work of bringing folks inside all the way up until COVID-19 was declared a, national world pandemic, basically. And so as they were full, and the shelter partners reached out to the county and asking for assistance because at that time, the Centers for Disease Control had asked that people social distance. And as you can imagine, homeless shelters being full during that time, what do they do for space? So they reached out to the county to say, hey, what can you do? What are some of the things we can do here as we're under mandate to try to have some space? And obviously we got a full building. At the same time, we were looking at a number of encampments that were surrounding our cities, mostly in St. Paul, but certainly throughout the county, that we were looking at how do we then manage those individuals who were outside or unhoused at the moment. So when the shelter partners requested assistance from Ramsey County, as more space was needed, we took a significant investment of the dollars we received, first of our COVID dollars under the CARES Act, and then also through our ARPA, dollars that continued. And we worked with the city of St. Paul because they were also closing some of the encampments for some of the stay-at-home orders that have been issued by our governor, and to say, where do those individuals go when they are already outside? And so that was where we were as a county, and how do we then say, how do we help? How do we come alongside our partners? And how do we help with obviously a significant challenge at that moment? So one of the things that I wanted to share in this slide was the existing and expanded shelter system. As you can see, like our partners in Higher Ground, they had roughly about 356 capacity. But as you can see, when COVID-19 capacity was significantly reduced, and where did they send those individuals? Same thing with Union Gospel Mission, who was a great partner with us, and even with our Safe Space program, which operate our emergency shelter overnight. They were able to find a little bit more space in the building and expand their space, but others were forced to say we had to reduce our capacity in order to meet those CDC guidelines. So at the time, some of our money was used as we looked at what type of places we needed to try to fulfill that, and how do we work with our community partners in doing so. You'll be reminded that during this time, we had a number of our hotels, and there was no traveling, so they were sending people on furloughs and laying folks off as a result of not having any business. So we saw it as an opportunity to partner with our partners so they could stay viable in business, as well as hire some individuals who might have been displaced. The county itself was, we had the housing stability team was not a team at that point. We were not in the department. And so we ran this under the incident management team, and I was asked to come over and lead that as the chief of housing operations during the COVID pandemic. And we wanted to highlight, I know we initially talked about in the first presentation about elderly individuals and how vulnerable they were. And so our first priority was to find a place where we can put our seniors who were most susceptible to, being significantly affected if they were to come down and contract the COVID virus. And so we partner with the hotel there to make a specific hotel for those individuals so they can be with like-minded folks. And it made it easier also for us to work with our public health partners to see, give education and have vaccine clinics and things where we were able to have them in one location. But we also looked at some hotel shelter alternatives. We also looked at some respite care, as you heard in the first presentation, where we wanted to make sure that if COVID did get into our shelter partners, they had a place to send individuals until they were fully recovered. And we can highlight partnering with the public health team around getting them back healthy and, having that respite care available. We also opened Bethesda, which is a hospital that's since been closed. We learned obviously that the hospital at that point was closing. And so we was able to partner with them to open up and expand some shelter operations in that facility as well. And then finally, we also wanted to make sure that we were putting people in places that they felt safe. There was, we talked about our trusted messengers, but we also wanted to make sure that individuals who had been wronged by government, that they had some place to go, and we wanted to make sure that we had places where they felt safe. And so again, we wanted and understood that Luther Seminary, we was able to house our women and couples. We learned that when we were closing encampments, that many of the individuals that were there, they wouldn't come inside because there wasn't any couples hotel or recognize them as couples. And specifically to the GLBTQ community, Q+ community, we also wanted to make way for them. Our goal was to make sure we had places that represented the county, and we were going to serve any and all that came to our doorstep. So these are some things that were literally set up overnight, and it required a significant investment and partnership with folks who were redeployed from various areas throughout the county. And it also made, made us aware of how much we needed to work with our HR department, many of the individuals who have been laid off and in our community, and talking about trying to sustain wealth within the marginalized community in Ramsey County, where many of the folks who ran toward the fire instead of away from it.
Mm-hmm.
And so hats off to our HR team that we worked hand in hand with to hire 180 plus individuals to come, because as we looked into partnering with hotel space, they wanted to make a significant mark on them being able to work with the county, but they were concerned about the population that was coming into their hotels. And so we had to have 24-hour operations, meaning, they had food services that were shut down. We had to partner with our local restaurants and things to make sure that we ran all of those individual programs in a 24-hour operation. Keep in mind the stay-at-home order did continue, and we also wanted to make sure that our partners was at the table to do things such as wraparound services. We wanted those to continue, even though it was during the midst of a pandemic. Some of those staff, we wanted to make sure that, who are these folks that have sometimes been wronged by government? And so we wanted to make sure we were sensitive in that, but you'll see that on the 24/7 operations site, we wanted to have staff that reflected the residents and had the diverse experiences. And much of our employment to those individuals that came to Ramsey County at the time, they came as limited duration, and hats off again to our IMT team, because they normally would have come as temporary staff, which did not have benefits attached. But these were significant things that this team and our incident management team were very intentional about, because they knew that if we hired people and they were working with populations who had contracted COVID, what happens if they had COVID or their families contracted it as a result of them running to help, our community needs. So those are some ways that we made sure that we spent the extra dollars to have individuals who had those opportunities with them. Just want to be respectful of our time. So also, pathways to housing stability. I mentioned that we still continue wraparound services with our partners and providers. We also needed transportation to and from medical appointments and other things that folks still had. And again, those wraparound services, keep in mind, we had 3 meals a day, that we had all these individuals, on-site mental health services, and healthcare and nursing were all at our facilities. Some of our PPE and all those things, hats off to our partners in public health for making sure that we were adequately equipped. And we were able to say that we had the protection things that we needed in place during that time. As we look at Bethesda, as I mentioned, we had 2 floors dedicated to COVID-19 respite care, so we was able to fulfill that need. And at one point in time, during COVID, Hennepin County prematurely shut down their respite. They had also brought up a respite operation, but they closed theirs down. We also helped them during this pandemic.
What was that?
So when Hennepin County, they closed prematurely.
Mhm.
And if you recall, when COVID, we had a second strain come around in the midst of COVID. And we kept ours running for longer, and we were in well positioned to be able to sustain the need that we had here locally. But we was also able to help with our partners across the river when they needed some additional space to house residents over here. We also was able to do 100 floors, or I'm sorry, 100 individuals on 2 floors. That was also for our regular shelter. And in addition to the COVID facility that we also had in one of the units there. When I mentioned Luther Seminary, this was on the campus, and we used the old former dormitory at the Luther Seminary campus in St. Anthony Park neighborhood. This is a space that really hit home for us because many of those who had been victimized were women and folks who represented those, GLBTQI plus communities. And so we was able to open that up for those individuals to come inside. And we use this as what we learned to call it an entry level. And then we later, in some of the hotels, had a hotel that will operate as a step up part of this. And this was once we knew that those individuals were there, they abided by the rules, the hotel owners were comfortable with them coming in, and they were closer and working with us to continue to search for permanent housing. We was able to move them through the system and use both of those for entry level, and then folks who we knew that could be sustained and stable enough to be in a hotel environment. These are some of the facilities we ran, and when I mean these facilities, these are 24 operation, and you can see the number of beds, and I can tell you that we remain full. You notice one type there that we initially had a shelter isolation location for 32, but as I mentioned, we ended up with 68 beds here. After all said and done, as we wanted to do a place where we can expand. We initially started in Boys Totem Town and used that as a respite. And we also used the Dorothy Day campus here, right, with the Luther or Catholic Charities. So a high level overview of ARPA investment, collaborative partnerships with cities, specifically like Minneapolis and St. Paul. We also worked with counties such as Hennepin, Anoka, and Dakota. This was we were reaching out because many of us were facing the same thing as we had a number of homeless encampments that were around. But we also, acknowledged our community partners such as Union Gospel Mission, Face to Face, Luther Social Services, Catholic Charities. These are all names and this is how we partnered. And many of these are also partners with us during our continuum of care partners. So they were there front and center and had been there before. And these are also those individuals who reached out to us for help. So we was able to move people from different locations. And if there were problems or issues with individuals, we was able to move those individuals out, but not kick them out on the street, but you move them to a different location. And these were all of the thought processes we went into trying to manage the different areas. One of the things that you don't see up here is that when we look at Interfaith Action was one of our family partners, they had a model before and they were moving folks from church to church on a monthly or bi-monthly basis, and they were limited to their capacity. We worked to make sure that they had a longer term semi-permanent placement, but they were able to increase their beds up to 100 beds. And that was able to serve those families that were in need during COVID. So we were happy to, that they were up here too as partners, but I just want to call them out because they were also working with us hand in hand as well. But physicians, Dr. Ogal and her team under public health, were there. We were meeting almost daily. But it was things that we did to just kind of make sure we had all around service work and that we can, you know, deal with what we were faced with. We had some emergency short-term gain. We was able to expand the shelters due to the need for social distancing. We provided temporary shelter based on space to enable existing shelters for that social distancing. One thing we was able to do, we was able to create what's called the highway to housing program. These were individuals that were close to getting apartments and they were stuck in our shelters and we were having issues with movement. And so people who were needing to come in, we was able to move them up to one of the partners until they were sometimes a month away from their apartment coming online. So we moved them to that environment so we can create space for folks to come in. So it was a good use of how we did that work and partner with our partners to make that happen. Some of our long-term games, one specifically by this table, who saw enough that the need was to have a new department in housing stability. And we became a department in February 19th of 2021. We also added 60 beds for that homeless families that I mentioned. We grew partnerships that were ongoing partnerships. And we also, when you talk about that community engagement, one of the key things that we learned from those who were using service, because I'll look back to Deputy Director Clemenson, raise your hand back there. Was led the work to really talk with our partners and talk with those who were using the service to say, when we had to downsize as those dollars were closing out, we wanted to find out what more do you need? What do you need? And we heard from them firsthand to say, we don't want another shelter. Many folks didn't want a place that they had to abide by the rules. They wanted to have some freedoms. And sometimes they want to come in and say a curfew is at this time or that time. They wanted a low-level barrier shelter that they can come in at any point during the night. And that's how we came up with our current warming spaces that have been since copied by, around the Twin Cities area and exist today. And we actually have them going on as we speak. So that is one of the things. We also added the single point of entry system. I know Dave was key to putting that back there. Dave, wave your hand back there. All right. And then night transportation, because as well, we had created some space. We knew that if you were homeless and you go to an area where you didn't know if there were any beds, when those individuals would get to a place and say they're booked for the night, they would just go somewhere and just, hunker down. When we had open space across town at another shelter. So we included that with our night transportation to a warming space so we could get better utilization of empty bed spaces around. And these were things that we were just doing all the way. And so it was a lot of, I like to call it creative stumbling along the way. But because we were able to community engage with those individuals, we were able to get firsthand knowledge and have them at the table, have our partners at the table who were experts in the work that they did to help guide us in what was needed. Be respectful of time here. So I think one of the immediate needs was that those who were in encampments and who had to, those encampments had to close, we was able to get them immediately some relief to get inside. They were able to have those wraparound services, work with our public health to make sure if they had additional needs that they were taken care of. We were also able to get them into systems and other things, mental health services, all were at the table during this time. So those are some short-term things that we said, shelter, food, and medical attention was ideal. Our long-term leveraging partners, never before, and I've said this before, that Minnesotans are best when they work together. And that was a time that it was critical. Not only was it with our partners, but just with our counties and our different departments. It was critical for us to get those services out the door. And those are things that we continue today, and we model those today. And I think it kind of helped set the tone for breaking down some silos that we've worked with. And I think that's where we were better able to get some long-term sustainability goals to say, let's work together on a problem. And I think that, that's repeated today as we speak. So we looked at the Research and Evaluation Unit in Ramsey County Health, Wellness Administration Division. Look back there. Okay, raise your hand back there. All right, so, but we was able to get some, our research and evaluation to see how do we do and where are some of the things that we can do as we move forward. But they evaluated 9 coronavirus aid relief and economic securities act, that's our CARES initiatives, including homelessness and housing assistance. I know this is a bit tough to read, but I just wanted to give you some ideas of the percentages of who we serve. And this is just from March to December 2020. Certainly this goes beyond that, but it gives you a good snapshot. We wanted to say, what about who are we serving? And on this, you'll see that it's like 690, which made up the percentage of folks, but ethnically, 428, which is about 62% of the people were people of color. And those are people that were in heavy need of assistance during this time. And those are the families and households that we serve. So you got the singles on the left side, and we've got adults and children on the right side. But this is something we wanted to put in here as well. We got a couple of statements from individuals who were impacted. And I'll just kind of flip through these here so we can get to questions. I know we're at time. But how does this change our work going forward? I think there's just a need for ongoing services. Our big 3 asks was one of the biggest things, as one of our commissioners here at the table, Commissioner Rand, actually carried our bill in that as we went to legislatively ask for funding for some of the things, because we saw that when we were properly funded, we were able to do some amazing things. And we wanted to continue some of these things like warming space and things. Those were things that were not levy funded. These were things that we, through our advocacy, was able to get funded. And so these are other things that we're doing, how we're moving our work forward. And I believe I hope that it's here to stay, but we've got some questions to answer there. Just wanted to remind a quick glance. We also like to make sure that our Housing Stability Department, at a glance, we are the demand, and our CED team, we work together because they are the supply. And so as we look to see, well, what can we do? How do we do it? These are what we're working with. We have an amazing team. We're a team of 33 FTEs, and we do a lion's share of some big work, and it's heavily impactful to the community. And this could not have been happening had not our Ramsey County leadership team not saw the vision to invest in these areas. I just wanted to touch base here real quickly, give you a snapshot of our continuum of care. And all of the folks who sit at the table during this work and who continue to sit here today. And just a relationship between funders, providers, and data, and the homelessness response system. Just another list of our community partners. So you are, seeing, and trust me, there's not all of them listed here, but you'll see that our Ramsey County, we got public health, workforce solutions, who obviously was there to try to make sure that when folks got housing, they were sustainable to be able to carry out making payments. Our sheriff department, who was able to redeploy staff and help us. Community corrections, who also redeployed staff. We're thankful for them, and the health and wellness team. FAS, veteran services, we're all at the table to try to, all hands are on deck, and that's the way that we continue to work together today. So, all right, how'd I do? A little bit over.
Great.
All right.
No.
All right. So what questions do you have?
Commissioner John.
Director Lattimore, great job. Oh my goodness, I just cannot believe how you had to lift this off the ground and keep it going, and that this is the way how we are doing things now, like working collaboratively. And for both presenters, I really appreciate you naming who our community partners are. That way it's clear to us about who's at the table, right? And in the future, as we look and say, is anyone else missing? That's very important. So I appreciate you doing that. I'm very curious about the decision to stay open when our peers across the river decided to close. What led to that decision?
Chair Miller.
Yep.
Commissioner Jean, what led to that? I mean, you look back and you see our public health department, as I was saying, we were meeting with Dr. Gowell and her team literally daily. we were saying, let's not do a knee-jerk reaction here. There's still some things coming, and because we had that communication and we work hand in hand daily and sometimes in the wee hours of the night, that is what prompted us not to close early. And as a result of that, we were able to be open during a critical time when basically the Twin Cities area was searching for space. And even the state was even stepping in saying, what can we do? Because we need to open up a hotel, another place. And we said, well, we got it. So we was able to do that just through the work of partnership.
Yeah, and I just would like to lift up, Chair Miller, that, that collaboration with the Public Health Department was transformative. Like, in the workforce space, we were the only spot in the state that actually had in-person career services during when everyone was unemployed. So I think it really was that deep partnership with public health. It transcends the housing department. It was happening in multiple areas in the county. And I think, just thank you to the public health team for kind of the foundation of all that, we didn't open any of those things without your support. So it was huge. So, yeah,
Great job to you
Yeah,
all
it was
for
really
working
good.
together so well.
Yeah.
Thank you, Madam Chair. Hats off to you and your team. I mean, what a wonderful, wonderful job, and working in collaboration with public health. I don't think I really heard like there was outbreaks or people, you kept this pretty tight, under some, some would say impossible conditions with impossible populations of people. So just kudos to you. And thank goodness for the CARES Act. How much did this cost?
I would say offhand, I know we've been quoting somewhere around 50 million and counting.
Wow.
Because of we extended it not just from that, we also invested to go further. I look back to my finance. We had like there, Alex, I know that.
I see
So,
Five
but
point 1 million here.
but I wanted to, no, that was just for that
5.1 million.
particular time.
Oh, wow.
I'm talking globally for all of what we did and for how long we did it.
Yeah.
Plus the investment of the housing stability and all of that. Those are the numbers, but it was for that period of time. Yeah, we have just for that period of time, but we're talking, I want to say we had CARES, well, not ARPA dollars that we were spending well into 2022, 23. So, yeah.
So it's just kind of like what it would take. $50 million to do this work and do it well and do it effectively. Or this was like.
Madam Chair,
This was some
Commissioner
unforeseen
Moran,
circumstances too, though. right?
Yeah, so what we were looking at is that what does it cost to have something similar to what we had during COVID? And the number that we got to was really around about $15 million a year investment to be able to do somewhat equivalent on a smaller scale to house up to 100 individuals in a 24-hour operation. So we have some shelter operations. We have some, we like to call it wraparound services that's also there. And for food and all of the stuff that will be needed. That's the number that we have been looking at from, what we need to operate the shelters along with our partners. So roughly about 15 million a year. And that would help, not just with their current operation, that would, because it's been significantly underfunded for quite some time, is to say that that's what we need to be somewhat able to do a portion of what we did during COVID.
All right, well, great job.
Well, my question kind of comes off of that is that not all counties decide to provide shelters directly. They partner with different community partners, and I guess what would be the lessons learned from this time that would inform like future decisions on the Ramsey County specifically's role in either supporting, coordinating, or providing this kind of housing going forward?
Madam Chair, Commissioner Jevin Singh. I think that we learned during this time that not everyone we served were originally from Ramsey County, but we did not turn anyone away. And I think when we looked at it, we were somewhere around 46% of just those individuals that were from Ramsey County that we served. The rest of them came from other areas. I think as we look forward, it will be in our best interest to make sure that everyone in the Twin Cities, whether it's working across the river or whatever, had some sort of response, so we're not moving people from their communities just so they can be in a safe environment. And I think that as we look at how we, what do we do, how do we do it, and when do we do it? Those are some things I think that we've got to be talking about now. So if this were a repeat, I think today, if it were to happen, we've been in the same situation we were then. But I think that's going to take some legislative work and also some investments, and not just us. But I think right now, if we had investment, we need the funds here because we carry the lion's share of services that we offer. And that is, I'm speaking to both Hennepin and Ramsey County are the big providers of this services. And I think some of our partners, suburban partners and suburban counties understand that they need to have some responses too, so they can do like-minded approaches as well.
Yeah, I appreciate that. And I guess one of the questions I have is in our warming spaces now, are we still able to provide some of those wraparound services, or have we had to scale back our operations post-COVID?
Great question, Commissioner. What we do now, we have the ability to connect folks to services when they are coming into the warming spaces. We also have day spaces that operate during the regular hours. Part of half of my team in the department actually works over at what we call St. Paul Opportunity Center. And we rent the second floor there to make sure we have places not just for us, but corrections and other partners and county departments are there to make those connections to individuals. We also partner with veteran services and other folks like that. But that is kind of where half of my team is at. And, that's how we're approaching it.
I have one follow-up question, which is, you talked about how we were able to recruit, how we were able to have some temporary workers who were helping during this time, and that we were able to set that up so it would be beneficial, so we weren't just treating them like temporary. Question is, we still need workers. Were we able to recruit and retain any of those workers?
Also another excellent question. So a lot of the folks that we were able to bring on and did end up finding permanent jobs in the county. We've hired a significant amount of them permanently. Some of them are still working with us in various roles. Some are also, still, we did extend it. Some of the, through a board action. So thanks, Gale County Board, for extending those opportunities to continue to have those individuals work with us. So some of them are still working with us today. However, many of them have found permanent jobs, and others, maybe found other jobs, but was able to use their work with Ramsey County as opportunities to get into other places of employment. So we either were employers to them or offered them opportunities as references to other jobs that they were seeking.
So kudos to your team, because not only were you helping folks during COVID that needed the housing instability, but you had business development, economic development, and workforce outcomes as well. So that's kudos. That's great.
Thank you.
All right, well, I just want to say thank you. I was at Interfaith Action, so I watched from behind the scenes, my Sarah Legal really uplift and, take that shelter and expand it, and that work could not have been done without you and your team, so thank you. So just to recap, hopefully I recap this correctly, so please bear with me if I'm incorrect. So it sounds like, and from what we've learned today from the ARPA funds, that the public health, that Ramsey County took a really unique opportunity to really partner with community on the Trusted Messenger, the TCCMC grant, and really transform the work that we're doing as a county. Same within our housing and reaching out to those community partners. We got creative in addressing housing insecurity and shelter through the needs of expansion, and providing those wraparound services. And when the county took a larger role in that, it seems to me that we did really meaningful work that has created sustaining change, or on the way to creating that change. So thank you both for, thank you, thank your team, thank public health, because it's really, the work you did is really important. Thank you.
Thank you.
Thank you.
And we're adjourned. I gotta,
Yeah, we are adjourned.
You needed the gap.
Really good. Wasn't too traumatic to go back in history.
Well,
Maybe gratitude.
yeah, so that's like, yeah,
How much work it was. You can't forget,
Yeah.